Hi, Ryan. I'm Heather, and I'm a nurse practitioner student with the University of Southern California. Thank you for letting me do a full body assessment on you. I'm going to start with your head and go down to your chest, your cardiac, your respiratory, as well as your neural and your musculoskeletal movements. If you have any questions during our exam, please feel free to stop me. I'm going to start with your blood pressure. Good. Your blood pressure is 115/72. Now I'm going to inspect your respiratory rate. And I'm going to feel for your radial pulses for your heart rate. His respiratory rate is about 22, and his radial pulse is about 45. And I feel for the other side for the same pulse. Good. So now I'm going to move on to inspecting your scalp. Your face looks symmetrical, your eyebrows are symmetrical, your eyes are symmetrical, your nose is midline, and your ears are symmetrical. So I'm going to feel for any lumps or depressions on your scalp. Let me know if there's any tenderness. Any tenderness?
No.
Good. So now I'm going to go on and palpate your sinuses and your temporal artery. Any tenderness?
No.
I'm going to have you clench your jaw. Okay. Now move your jaw side to side. This tests cranial nerve 5, which is this trigeminal. So now I'm going to have you smile, frown, puff your cheeks. And this is test cranial nerve 7, which is the facial muscle. So now I'm going to go on and inspect your eyes. We're going to start, I'm just going to pull down a little bit. Your sclera is clear, your conjunctiva is clear, your eyes are symmetrical. Now I'm going to stand with my visual acuity chart at the 6-foot mark line that I have. You can cover your eye and read the bottom of the line.
LTFTH.
Now I can switch.
LTFTH.
Now both eyes together.
LTFTH.
According to this chart, he has 20/20 vision. So now I'm going to go on with my pen lights. And I'm going to check for cranial nerve 2 and cranial nerve 3, which is his optic nerve and his ocular motor nerve. Okay. Look straight at the pen light. Good. So now follow my finger in. So now I'm going to test cranial nerve 3, 4, and 6, which is his ocular motor, his trochlear, and his abductus. So I'm going to have him follow with the pen light. Good. And now I'm going to have you look at my nose, and I'm going to test your peripheral vision. Let me know when you see my fingers wiggling. Good. Good. So now I'm going to have you cover one eye. Look at my finger. Now uncover your eye. Good. Now do the same thing. Look at my finger. Now uncover your eye. Good. And that was the cover-uncover test. So now I'm going on to inspect your ears. I'm going to look for any foreign bodies. No. No. And I'm going to tug on his ears. Any pain?
No.
Okay, so now I'm going to test cranial nerve 8, which is acoustic, his acoustic cranial nerve. So first, if you could plug this ear, I'm going to whisper something and repeat it.
Apple.
Good. And I'll do the same thing on this side.
Baseball.
Good. So now I'm going to do the Weber test. And I'm going to hit the tuning fork and place it at the center of your forehead. I would like you to know if you feel the vibrations the same in both ears. So now I'm gonna go on to the Renee test, and I'm gonna hit the tuning fork, place it behind your ear, and when you don't feel it, let me know, and I'm gonna move it to in front of your ear.
Okay. Okay.
Good. Air conduction is greater than bone conduction in his right ear.
Okay. Okay.
Good. Air conduction was greater than bone conduction in his left ear as well. So now I'm gonna go on to inspecting your nose. At this point, I would usually ask you to smell something, and this would test your cranial nerve 1, which is your olfactory. Your nose is midline. Your septum is midline. If you could just lean your head backwards a little bit so I could look. No foreign bodies. So now I'm going to move on to your mouth. Your mouth is symmetrical. If you could open. He has all his teeth. His gums are moist and pink. Now if you could say ah. Good. One more time. Checking his hard and soft palates, which is cranial nerve 9 and 10, which is his glossopharyngeal and his vagus nerve. If you could take a sip of water, I would like to watch you swallow as well. Good. Symmetrical swallowing capability. If you could stick your tongue out, move side to side. Good. This is testing cranial nerve 12, which is his hypoglossal. So now I'm going to move on. We're going to test cranial nerve 11, which is his accessory nerve. So if you could shrug your shoulders against resistance. Good. Pushing your hand against my cheek. Good. Good. So now I'm going to just palpate your trachea. Make sure it's midline. Good. If you get your water ready, I'm going to test your thyroid. Palpate your thyroid. Okay, go ahead and take a sip of water. Good. So now I'm going to test, you can put your water to the side, your lymph nodes, and I'm just going to feel if there's any bumps or lumps within your lymph nodes. Let me know if there's any tenderness. You turn your head to the side. I'll turn your head to the other side. Good. Your lymph nodes seem fine. No tenderness at all? Good. So now we're going to go on to your chest exam. Do you mind removing your shirt? Okay, so now I'm going to palpate the top of your chest. Any pain or tenderness?
Nope.
So now I'm going to feel for your carotid pulse. Good. Now I'm going to listen for any bruise, which is any whooshing sounds in your neck. Good. So now I'm watching your breathing. I'm checking out your chest diameter, and it's good. You have comfortable breathing. His AP diameter is good. It's in normal range. So now I'm going to place the side of my hand to your chest. Every time I do that, I would like you to say 99. You're checking for tactile fractus.
99. 99. 99. 99. 99. 99.
Good. Now you're going to listen to your lung sounds on the front. So if you could breathe in every time I place my stethoscope to your chest, this hard here. Good. So now if I could have you sit back on the table a little bit. I'm going to walk around to the back. Perfect. Now I'm going to do some percussion on your back first. Any pain?
Nope.
Good. So now I'm gonna also pace the side of my hand to your back again. I would like you to say 99 again.
99, 99, 99, 99, 99.
Good. Tactile pharmacist says negative on both front and back. Now I'm gonna have you breathe in and out as I place the stethoscope to your back. Good. Now when I place the stethoscope to your back, I would like you to say E.
E, 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 E.
Okay, and now every time I place the stethoscope to your back, I would like you to whisper 1, 2, 3. Okay, now I'm going to percuss for diaphragmatic excursion. So there's going to be a couple pen marks on your back. So first I'm going to start by take a deep breath in and hold it at the top while I percuss. Okay, I'm making a pen mark here. Let go. Now do that again. Okay, let go. Now this time I would like you to take a deep breath and then hold it at the bottom. Okay, pen mark here. And one more time. Good. And also while I'm back here, I'm going to check your kidneys and I'm going to check for any CVA tenderness. Any pain?
No.
Any pain?
No.
Good. And your diaphragmatic excursion is less than 4. Good. So now you can come back up to the front of the table. And now I'm going to test your upper extremities and your lower extremities. So we'll start, if you can hand me your hands, I'm going to check for capillary refill, which is good. If you can put your fingertips together, checking for clubbing. Good, negative for clubbing. So now I'm going to have you flex your hands up, flex your hands down. So outside, inside, and rotate them out. Rotate them in. Good. Now push your wrist up. Good. Push your wrist down. Good. We're going to check our Fresnel sign. Any pain? This test for carpal tunnel. So now I'm going to check for Tennille's sign. Any pain? Other arm? Any pain? So now we're going to do your Allen sign. I'm going to have you open and close your fist real quick and hold it. And then when I tell you to let go, you'll open your arm again. Okay? Ready? Okay, let go. Good. And we're going to do it again to test the other artery. Okay, let go. Good. Both ulnar and radial arteries are intact. And we'll do the same on this side. Okay, let go. Good. And once more. Let go. Good. Ulnar and radial arteries on both left and right are intact. So now we're going to move on to testing your elbow range of motion. So you go forward, and back, push against me to push them out. Okay, now try to close. Good, same on both sides. Now we're going to move to your shoulders, arms up, watch the light, arms down, back and front, back and front. Going up, arm up to the front and back, and then up to the front and back. Good. And then onto your side, I just want you to lift your arms against resistance. Good. Now push them. Good. We are now going to check your reflexes. Okay, we're going to start with his brachial radialis. Good. And on his left. Good. Now you're going to go on to his biceps reflex. Bend your arm a little bit, relax. Good. Relax this arm a little bit. Good. So now we're going to go on to your triceps reflex. Relax your arm in my hand. Good. Relax. There we go. Okay, and while I'm here, I'm going to check for the lymph nodes underneath your armpit. Good. I'm going to go back and test them on the other side. Good. I didn't feel anything. Did you have any tenderness there? Good. So now you're going to go on to your lower extremities. I'm going to stretch your knees out. Straighten. Now bend. Okay. Now against force. Okay. Hold up. Good. Now I'm going to go on to his ankles. Push down. Push up. Rotate them out. Rotate them in. At the same time, I'm also checking out his hair distribution, which is even all the way down his legs. There's no varicose veins. I'm feeling his popliteal. I'm also checking his patellar pulses. And I'm feeling his PDO pulses. No edema in his legs. And now I'm going to go and check his reflexes. So I'm going to check his patellar reflex. Good. Now I'm going to go down to his Achilles reflex. I'm going to hold your foot in my hand. Good. And now I'm going to check your plantar reflex. Good. Negative for Babinski reflex on left and right. Good. So now we're going to continue on with our neurological exam. I'm going to use this Q-tip, and every time you feel the Q-tip touching your skin, just say yes. Okay, close your eyes.
Yes. 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 Yes.
Good. So now I'm going to have you open up your hands, close your eyes. I'm first going to write a number with them on my fingers, and you tell me what number it is.
3.
Okay, good. On this side.
7.
Okay. So now keep your eyes closed, keep your hands out. I'm going to place 2 objects in your hands, one at a time, and you tell me what it is. First, your right arm.
Okay.
Go ahead and say it.
Okay.
Oh, good. You could go ahead and I can take it back. And I'm going to place something else in your other hand. Please tell me what it is.
Quarter.
Good. Now, I'm going to have you keep closing your eyes. I'm going to poke a spot on your arms or on your legs, and I would like you to then point to where I poked you. Good. Good. 1 point discriminancy in place. Brachystesia in place, and stereogenesis is also in place. One more thing I'm going to test real quick is we just did the sensation with the Q-tip. I'm going to test the same sensation with the tuning fork. I'm going to hit it and place the tuning fork in your hand. I want you to tell me if you feel the tuning fork evenly in both hands. So open up your hands, close your eyes. Even? Good. Now I'd like to ask you, you can open your eyes and relax, a couple of mental questions. Where are you right now?
In your house.
Okay. What day is it?
August 5th. Saturday.
And what year is it?
2017.
Good. So now you're going to go on to some finger to nose movements. I'm going to have you touch your nose, then touch my finger. Touch your nose, touch my finger, okay? Good. And so now I'm going to have you do some rapid hand movements. So I'm going to just have you turn them hands up, hands down, hands up, hands down. Good job. So we are now going to move your heel up your shin. And now do it the other side. Good. So now we're going to move on, and I'm going to have you lay down. First, I'm going to check for his JVD. Get my measuring tape out and a straight edge. JVD is at 3 centimeters. So now I'm inspecting his pericardium. Fine, there's no pericardium activity going on. So now I'm going to palpate for any thrills and heaves. No thrills or heaves. So now I'm going to have him turn over onto his left side. Now I'm going to listen to his heart sounds in all 5 locations with both the diaphragm and the bell. Switching to the bell. I'm also now going to feel for the apical pulse. Patient has intact S1 and S2, no split, as well as no S3 or S4. Okay, and while you're on your left side, we are going to do your abductor test, and this is a sign of appendicitis. I'm going to have you I'm just going to pull your leg back. Any pain?
No.
Good. So if you could roll back onto your back. Now I'm going to inspect your abdomen. Looks fine, flat. And now I'm going to listen for your bell sounds in all 4 quadrants. Okay, I'm now going to percuss for your liver. Okay, and now I'm going to do light palpation in all 4 quadrants. Let me know if there's any pain or tenderness. Okay, now deeper, going to go a little deeper. Good, any pain there? Good. Now I'm going to check for your femoral pulses. Now we're going to check for any, I'm going to press down in your lower quadrant here and let me know when I release if there's any pain.
Okay.
Any pain? Good. I'm also, so he is negative for his erosive sign. So now I'm going to check for your psoas sign. So I'd like you to lift your leg against resistance. Any pain?
No.
Okay, relax. Relax. Good job. So now I'm going to do some hip range of motion. But first, before we do that, I'm going to lift your leg. This is the Kernig sign. That's for meningitis. Stretch. Any pain in your back?
No.
Okay, same on this side. Bend it. Now straight. Any pain?
No.
Good. So I'd like you to lift your legs, hips up. Okay, down and out. Okay, now push against my arm. Good. Same on this leg. Up. Out. Now in. Now push against. Good. And so now we are going to do your Brudzinski sign. So I'm going to lift your head. Just relax. Brudzinski sign is negative. There was no knee raise. And then I'm also going to check your Murphy's sign. So I'm just going to hook my finger right here against your rib cage. Now breathe in. Breathe out. Any pain?
No.
Good, and I'm just gonna go a little bit deeper. Breathe in. Good. No pain?
Nope.
And now I would just like you to sit up. I'm gonna have you turn on the table, and I'm just gonna listen to your heart sounds while you're leaning forward. And then I'm gonna use it with the other side. Good. And for our last part, I'm gonna have you stand up, and we're gonna just assess your walking. So if you start by that wall, and just walk towards me, and then walk back towards that wall. Normal gait. Now if you can walk heel to toe. Good. If you could walk back walking on your heels. Good. Now come back walking on your toes. Good. So now I'm going to have you step back a little bit. And then we're going to test your Romberg test. So legs together, eyes closed, arms forward. There's no drifting. And now we're going to test his plantar drift. Good. So I would just like you to turn around just so I can assess your spine. So if you could bend over. Now stand up. Good. And his spine is intact. So that concludes our full body assessment. Thank you so much for participating.
Thank you.